think the biggest strength of the fellowship is diversity. That basically we allow the fellows to control their education in the sense of it's like college. You have prerequisites and you get to pick your major. So we have a very diverse faculty which has shoulder to fingertip experience. If I have a fellow coming here who really wants to do shoulder arthroplasty and become very conversant in that, we can cater their experience to give them a lot of clinical experience in shoulder arthroplasty. If I have someone who's trained as a general surgeon or a plastic surgeon who wants to do more soft tissue surgery and more forearm to hand surgery, we can provide that experience as well. The weaknesses of the fellowship, well, I mean, I don't think there are any weaknesses really, but if I had to point to something that's not as much of a strength, I would say congenital hand surgery and microsurgery. We do give the fellows a good experience in flaps. They rotate with a couple of the flap surgeons and get to participate in flap surgery, but it's really not a fellowship for someone who wants to exclusively be a free tissue transfer surgeon or a congenital hand surgeon. I think the fellows we look for, to put it simply, are people who are active learners. The more you know what you want to learn, and the more you're able to set your own goals, we will help you achieve those goals. So I look for people who are active learners, not just to kind of like, okay, this is what we're going to do, and I'm just going to show up every day and do it. I want someone who really challenges the faculty and has goals when they come in here. I want to learn this, or I want to learn that. And the more specific your goals are, the easier they're going to be to achieve. We've worked very hard over the last couple of years to really integrate the residency and medical school into the fellowship. I am the head of the summer research program, where we have medical students who are usually between the first and second year of medical school. Occasionally there are also undergrads who participate in the program to do 10 weeks of mentored research. And in the past, I've paired med students with our fellows to work on their research projects, and also paired medical students with residents, and in some cases all three. We'll have a project where we have a medical student, a resident, and a fellow. I think that works very well because the residents are here for longer to get projects up and running, finish the projects after the fellows leave. Med students are here for 4 years, and the fellows are here for 1 year. So I think having everyone work together on a project allows things to be seen through to completion. The fellows have a requirement to complete a project, which could mean producing an abstract or producing a publication or a presentation at a national meeting, which could be a poster also. It doesn't have to be the project that they start. We have a continuum of projects given the 12-month nature of the fellowship and IRB submissions, things like that. It can be difficult sometimes to complete a single project within 1 year. So lots of times our fellows will pick up a project that was almost done and complete it and start another project that they hand off to the next fellow. One of the strengths of our fellowship that they definitely have an opportunity to specialize or focus their training. We have a very broad faculty with diverse experiences, from congenital and hand surgery to shoulder elbow surgery. So our fellows are allowed to pick who they want to rotate with. Look at it as like a college experience that, in college you have certain prerequisites, but you get to pick your major. So we allow our fellows to come in here and pick their major. If you want to focus on elbow arthroscopy, you want to focus on shoulder arthroplasty, we give that experience. If we have someone training who's a plastic surgeon or a general surgeon who wants to focus more on forearm distal hand surgery, we provide that experience as well. Call schedule is good, but not onerous. We cover 2 level 1 trauma centers, Erie County Medical Center, which is the adult trauma center, and Oshai Children's Hospital, which is the pediatric trauma center, which is probably obvious given the name Children's Hospital. The primary person responsible for calls from the ER and from the floor are the orthopedic residents who cover those facilities 24/7. If there's a case that needs a higher level of expertise, they'll contact the faculty, and that's when the fellows will get involved. Usually I will only involve fellows for procedures in the emergency department. If a resident needs mentoring or help pinning a fracture, that would be a case a fellow might come in for, or operative cases. If there's a replant or a complex trauma that's going to the OR, those are the cases that the fellows come in for. And it's not onerous. It certainly doesn't happen every night. Probably, the faculty are on call for 10 nights at a stretch and probably end up coming in for 1 or 2 of those nights, maybe a little more during the summer, a little less during the winter. In addition to the main training sites of Erie County Medical Center and Oshai Children's Hospital, our fellows rotate to multiple different ambulatory surgery centers. We are blessed with a multitude of state-of-the-art ambulatory surgery centers that are high volume, efficient, kind of places you'd want to practice when you finish your fellowship. So you really get to do a lot of cases in very nice settings. The fellows live all over. We have one sort of property in Clarence that the fellows pass from fellow to fellow. So there's always one fellow who's living at this place in Clarence that I've heard it's very nice. I've never actually seen it. Clarence is an eastern suburb. Some people choose to live a little closer to town. Another big advantage of Buffalo is there's not a lot of traffic, and the hospitals are located, for the most part, pretty close to major highways. So no matter where you live, it'll be nice, and you won't have to drive too far, and there's not a lot of traffic. I think Buffalo is a great place for a number of reasons. As far as the medical campus, the developing medical campus downtown provides state-of-the-art simulation. If you want to practice elbow arthroscopy, our lab's open. You want to practice shoulder arthroscopy, great. You want to do a research project in a biomechanical lab, we have those facilities too. So as far as like physical plant and facilities, I think we're second to none, particularly in terms of our new simulation labs. As far as just a city to live in, if you like sports, Buffalo's got 2 professional sports franchises, numerous Division I universities, and Division III as well, and community colleges, which if you're interested in sports hand, a number of faculty cover those teams, so there's the opportunity to have that as part of your education as well.